Good afternoon. I'd like to call to order the Health and Human Services and Aging Committee. Today is Wednesday, February 16th, and it is currently 1:03. Can we have a roll call, please?
As a reminder to all in attendance, this meeting is being recorded and live streamed on the county YouTube page. Calling the roll, Ms. Conwell,
Present.
Mr. Sweeney,
Present.
Ms. Turner,
Present.
Mr. Miller,
Present.
Ms. Stevens. Ms. Stevens is absent at the moment. We have a quorum.
Thank you. Anyone signed in, Madam Clerk, for public comment?
No, Madam Chair, no one has signed in.
Right. I'd like to put forth an approval of the minutes from the February 2nd, 2022 meeting. Can I have a first and a second, please?
So moved.
Second.
Okay, moved by Sweeney, seconded by Turner. All in favor, please say aye.
Aye.
All right. We have a couple of items that are referred to the committee today. And Madam Clerk, if you can read the first item into the record, please.
Resolution 2022-0036, authorizing an amendment to contract number 858 with Mental Health Services for Homeless Persons, Inc., doing business as Frontline Service for emergency shelter services for single adults and youth at North Point Temporary Housing located at 1550 Superior Avenue, Cleveland, for the period January 1st, 2021 to December 31st, 2021, to extend the time period to August 31st, 2022, and for additional funds in the amount not to exceed $948,622.
Good afternoon, David Merriman, Department of Health and Human Services. Madam Chair, council members, we have two items before you today from the Office of Homeless Services. Presenting those items will be Paul Porter, the Director of the Division of Contract Administration and Performance. Paul's also joined today by Melissa Sirak, the Director of Office of Homeless Services, her team, and a selection of the providers that will be reviewing these items. So I'm going to turn it over to Paul. I do also just want to acknowledge that unfortunately we have an open staff forum today at 1 o'clock that relates to a lot of the recent security matters and safety issues that have gone on within our child welfare system. We're gathering information from those reports and from our staff. So I'll be stepping out a few minutes early, and just really grateful for council's hearing of these items today, and for acknowledging that this is really important work, and that our providers have come forward to talk about the services as well. Thank you.
Thank you.
Thanks, David, and afternoon, council members. Paul Porter, Health and Human Services, in this case on behalf of the Office of Homeless Services. The first item before you today is an amendment extending the county's contract with Frontline Service for temporary housing at the North Point building at 1550 Superior Avenue in Cleveland. This is temporary housing focused specifically on youth and young adults. This contract was entered into via alternative procurement for 2021 because the vendor submitted a proposal for these services during calendar year 2020 for federal funding. I believe it was part of the initial CARES Act allocation where they applied for federal funding for these services. And rather than asking the vendor to submit, essentially a copy of their proposal again, we made the initial award on the basis of that proposal from 2020. The contract did contain an option to extend. We are exercising the option, and we're looking to extend it just to August 31st of this year. My team has worked with the Office of Homeless Services as well as other departments throughout Health and Human Services and the county's Department of Development and the Office of Innovation to get a new master RFP out on the streets for homeless services. You're probably familiar with the term master agreement for some of the big agreements we bring forward that have multiple vendors. This is like that, but even broader in scope. Depending on your familiarity level with what various procurements Office of Homeless Services has done in the past, you may recall that most of them are typically narrow and tailored either to a specific service and or a specific funding source. What we're trying to do with this master RFP is seek proposals for all of the services that are provided under the homeless services continuum of care so that we're able to reduce the volume of work required by the county in terms of preparing RFPs, reviewing proposals, and entering into separate agreements, as well as reduce the work that the vendors have to do by allowing them to submit a proposal that may contain multiple services within the same proposal. We realize this is a big change for the vendors as well as for our team. Again, we're used to reviewing these services kind of in their own silos, if you will. We've done a separate RFP for men's shelter services, a separate RFP for women's shelter services. It's our hope by putting out a bigger proposal that we'll be able to foster collaboration, that we might receive proposals where multiple vendors work together instead of competing against one another to deliver the services. So hopefully things could be a bit more efficient and a bit more effective, not just focused on reducing the work that we have to do and that the vendors have to do as part of the RFP and proposal submission process. That's why we're doing just an 8-month extension instead of a full year extension. As indicated in the resolution, the funding amount is $948,622. This contract, as well as the other one, and the same things I just discussed with the master RFP, that's going to close March 11th. So we will go through the review and award process in the coming months after that closes. We held off on submitting these amendments while we worked through the development of that RFP so we could determine, how quickly do we think we'll be able to get contracts in place from that RFP. And we were able to determine that hopefully allowing 8 months till the end of August would give us enough time to come back with contracts that'll start 9/1 for these services and others based on that RFP that's out right now. I'd also like to note, just in terms of that RFP, we had an innovative approach to bringing vendors together. We did our traditional pre-proposal conference where vendors could ask questions about the RFP. We would go over the broad contours of the RFP and make sure they're on the right track with their proposals. A week later, this past Friday, we invited vendors to do a virtual open house with the goal of kind of bringing them together, talking through ideas that they may have, seeing where we can kind of foster collaboration. And it was also a good opportunity for us to get feedback from the vendors as they've gone through the process of developing their proposals. One of the things that we heard was vendors felt like with the scope of proposal that we were asking and the type of collaboration we're requesting, they would benefit from a couple more weeks to complete their proposals. So our original due date was the end of next week. We pushed it back 2 weeks to March 11th to kind of be responsive to vendors and allow them a bit more time to get their proposals in. I am happy to answer any other questions about the Frontline item. As David mentioned, Melissa is here from the Office of Homeless Services, as well as her staff members, Aaron Reardon and Allison Gill. From Frontline, LaTanya Murray is present representing the vendor for this first item.
And Mr. Porter, I would like a list of all the providers that will be participating. So you said over the whole homeless continuum, like YWCA, 2100, North Point, all of them will be able to participate in this master RFP?
Correct, Councilwoman Conwell, and we can get together a list of, services that are funded right now. The other thing that we want to mention is we've asked vendors as part of their proposal submission to bring new ideas to us, not just tell us, what you're going to do with the existing service delivery models. We could foresee folks proposing major projects at some of the existing shelters, or as part of the RFP, developing additional housing units. Also, since this isn't just exclusive to shelter services, we're also seeking proposals for things like diversion things like, foreclosure and eviction prevention, helping to keep people in housing that may be unstable, but with a little bit of help, they could stay there. So it really is, a broad effort to seek proposals for a variety of different services. So we can certainly provide you with the list that was in the RFP. Just keep in mind that that was only, kind of a jumping off point or a set of suggestions. We fully anticipate and hope that vendors will bring new and fresh ideas to us, and that really, by going through this type of solicitation process, as opposed to the process that we've been used to in the past, where we're seeking proposals for this narrow, tailored service, we're hoping that that leads vendors to kind of think outside the box and give us, good ideas that are going to lead to the best service delivery possible.
The other vendors' contract dates that are ending, do they line up with this new RFP?
So there are some of them that may go till the end of the year. I think some of them, depending on the funding source and what we did with their last amendments, may go further out. So there's a possibility, as we're going through this award process, that some of the contracts and awards from this RFP might start on a different time frame than others. We asked vendors in their proposals to talk about like what timeline they would want to do for the project instead of us prescribing that. Because we realize, especially if a vendor proposes something that's more like construction or renovation, they might have to, abide by a timeline through whatever contractor they're going to use. So really, I can't say 100% exactly what those timelines will look like.
What would that dollar amount look like, general figure for a master contract such as this?
Sure. Can I respond offline about that? That's a question that has come up from vendors. We have not put a specific dollar amount on that. My joke on the pre-bid call when that was asked was, when we throw a dollar amount out, it's funny, a lot of the proposals come in right around that dollar amount. So maybe we could have a follow-up conversation about that.
Okay, and will this, has it been consideration given, would it line up with, and I don't know, most of the agencies are primarily just funded by the county, or do they have additional funding sources? And would that line up with
Sure.
if they're getting federal dollars?
Great question, Councilwoman Conwell, and this is kind of a preview for you, Councilman Miller, for an item that's going to come forward to the Board of Control next week. I'll use the Emergency Solutions Grant contracts as an example for this. We're in the process of bringing forth awards on that, and it was a combined RFP that was done last summer between the county and the city, because the city of Cleveland gets their own Emergency Solutions Grant dollars from the feds. So when we make award determinations, we try to the best of our ability to maximize the various funding sources that help fund the continuum of care. So as part of the proposal process, we've asked vendors to identify other funding sources that they have, whether it's federal funding sources, money from the state, foundation dollars, and we've indicated that as part of the scoring process, vendors who can demonstrate the ability to leverage additional funding may get a higher proposal score in that budget section or the finance scoring than vendors who are asking the county to fund 100% of the costs of the project.
Sorry about that.
So, first of all, Madam Chair Director, I'd like to also receive the list of services that are going to be included under this contract. My second question is, in coming up with the 8/31/22 start date, did you take into consideration that the council usually recesses very early in the month of August, so that if you want contracts in place for September 1st, they would have to be approved at the first meeting in August.
Absolutely. Thank you for that, Councilman Miller. That was part of our deliberation about the scoring and award process. We're anticipating, based on the number of vendors who participated in the pre-proposal conference, that we could get dozens of proposals under this RFP. As I mentioned, it was originally slated to close towards the end of February. We're now going to be going into mid-March. We're confident that having 2 or 3 months to get awards together, that we would be able to bring this to council sometime during the month of July. That's kind of our target date on it. That allows time for us to review the proposals, look at the budgets for each of those proposals, make determinations about who's going to get an award and how much that award will be, and then ultimately enter into contracts with the vendors. One of the things I did try and stress, as much as I could during the pre-bid conference, was that vendors have to include the cost of complying with our insurance requirements in their proposals. The biggest source of delays is we're bringing late items before you, and I think I speak for multiple departments about this, is making sure vendors can comply with the county's insurance requirements. Tyra knows how often we've had to go back and forth with vendors, with representatives from the law department, to negotiate and make sure they're able to get adequate insurance coverage. We're trying to do more to stress on the front end that, as your agency is crafting a proposal, talk to your insurance broker then, not when I call about making an award, because we don't have time to wait for you to get updated insurance coverage. And you need to make sure that your proposal has a significant enough dollar amount to cover any costs associated with the insurance.
So, given the complexity of the contract that you're going to bring, I would think that introduction at the first council meeting in July would be the absolute latest that it could come and get passed at the first meeting in August.
That is certainly our target, Councilman Miller, and I had even hoped that maybe we would be able to get it introduced in June. We'll just have to see, part of it's on our team to get it done, part of it's on the vendors to make sure they get us compliant documentation in a timely fashion.
Finally, I have a comment, which is that I am very well aware of the advantages of master contracts and how much administrative work it can save and how much it can simplify the process. But I think in this case you may have overreached. The master contracts that we've done in the past have involved a large number of vendors, but a somewhat unified group of services. While this is very diverse, and my concern is that it might make it difficult for the council to give the amount of oversight, consideration, and discussion on when so many different kind of items are being brought at the same time. I mean, particularly, you could bring women's shelter items, you could bring men's shelter items, you could bring winter homeless services items, you could bring transitional housing items. It's just a wide variety of stuff, and if you bring all that stuff in a single contract, I think it may just be difficult to give it the time and attention that it deserves, and and difficult to come up with all the questions in a single shot that when you have to focus on so many different things at the same time. So I have concerns about this.
If I could offer one comment, Councilman Miller, and then I'll turn it over to Melissa. Doing a master RFP does not mean we have to do a master contract out of that RFP. I think our goal is to look at whether it makes sense to do individual contracts by service, because you're absolutely right. These services are disparate and different. We were looking more at efficiency on the front end with the proposal submission and evaluation process, especially as we went through several alternative procurements over the past 2 years to make awards to vendors who had submitted proposals for the same service, but we entered into contracts using multiple funding sources. I know that typically when you make a contract or multiple contracts out of the same RFP, we're often asked to group those contracts together when they appear on either a council agenda or a board of control agenda. However, I think we'd be allowed to have discretion or could work with this committee or council to keep those items separate for review, if that would enable, more time to develop questions on the unique items. But I just want to be clear that we would not have to do kind of an omnibus contract that had shelter services and coordinated intake and all the like. Melissa, do you want to jump in on that?
Sure, just add one more point. Good afternoon, Council. Melissa Serac, Director of the Office of Homeless Services. Other than the point that Mr. Porter just made, I wanted to add that this contract was done, as he mentioned, from an alt procurement from the Emergency Solutions Grant RFP that came out. That has served as our master RFP. In our office, we've worked to align contracts by utilizing that process, which, to your point and question, Councilman Miller, is a narrowly focused RFP based on shelter, homeless prevention, et cetera. So I would anticipate that this particular vendor would probably encouraged and apply again for that same process. And the ARPA process that Mr. Porter is referencing would be for any additional innovative or enhancements that they might want to make to that program at that time. That would be their continued funding through that ESG process and RFP release.
Okay, thank you.
Yeah, I had concerns about that too. So when was this decided, Mr. Porter, to do this kind of master RFP?
Thank you, Councilwoman Conwell. We started discussions around that last year as we looked at kind of the number of different contracts that in some cases we had multiple contracts with the same vendor for the same service, but just different funding sources, or we were asking vendors to submit one proposal after another for the same type of service. This was looked at as a way to kind of blend some of those opportunities to reduce the number of proposals that those vendors were being asked to submit. So it's something that we released the RFP earlier in the month of February, and it's something that we've had ongoing discussions about for the last several months.
Any other questions from my colleagues? All right, hearing none, seeing none. Since it's being extended, do you need the second reading suspension?
If we could, Councilwoman Conwell, since this does date to January 1st, it would be great to get it approved with second reading suspension.
I'd like to move R2022-0036 to the full council. Is there a second?
Second.
Under second reading suspension, all in favor, please say aye.
Aye.
And offline, we'll set up a meeting with me, you, and Levine
Absolutely.
to answer those questions that you couldn't answer, and then to hear more about this RFP. Madam Clerk, if you could read the next item into record.
I'd also like the record to reflect that Councilwoman Stevens is in attendance. Resolution 2022-0037, authorizing an amendment to contract number 769 with Young Women's Christian Association of Greater Cleveland, YWCA, for emergency shelter services for single adult women at the Norma Hare Women's Shelter located at 2227 Payne Avenue, Cleveland, for the period January 1st, 2021 to December 31st, 2021, to extend the time period to August 31st, 2022, and for additional funds in the amount not to exceed $1,834,529.
Good afternoon, Paul Porter again on behalf of the Office of Homeless Services. This is a similar type of extension for a contract that we entered into as an alternative procurement with the YWCA based on a proposal that they had submitted in calendar year 2020. This was initially for services throughout calendar year 2021, and we're extending the time period to 8/31/22 for the same reasons as the item that was just presented. So again, this is for the shelter services that are provided at the women's shelter. This is different than the item that was before the Board of Control last week for facilities management of that shelter, which Eden has a contract for.
This would, 1 and 2 would kind of fall under the master RFP.
Yes, thank you, Councilwoman Conwell. These services would be included in that as well. And I neglected to mention that we do have, in addition to representatives from the Office of Homeless Services, we've got 4 staff from YWCA. That includes Teresa Sanders, Cynthia Daly, Deb Matisse, and Billy Gilliam.
If they could speak to how do they think this will, if this will benefit or hinder their participation in this RFP. And my other question would be, I'm just concerned about the dates. So if everything doesn't line up, or I guess we're going to make it line up, right? Where all the vendors, when their initial RFPs in, they would all be on this master agreement going forward.
That's our goal, that the proposals that they submit, whatever contract or contracts that we enter into, because again, it could be separate contracts by vendor. The only master piece of this is seeking the proposals at the same time. We would make sure that those contracts line up with when the current contract ends. Our goal with these services are to have them start September 1. Is that correct, Melissa? Whatever new contracts we enter into?
Good afternoon again, Melissa Surak. This would be similar to the previous contract we just reviewed, where we would be utilizing our ESG as the master RFP. This is separate from the ARPA, and that includes using that award for not just ESG dollars, but levy dollars as we have here. So this provider would follow that timeline, which the RFP would be released second quarter of this year, and then therefore would then align Councilwoman Conwell. Their contract would continue.
Okay, so when they're presented on the agenda to us, since it's a master RFP and not a master contract, would they be presented, continue to be presented in this individual format?
I would anticipate that, yes, especially because it's different funding sources.
I think that goes to your point, Councilman Miller. All right, so if I can hear from some of the vendors and how they feel about this process. State your name for the record.
Good afternoon, Teresa Sanders, YWCA Greater Cleveland, Norma Her Women's Center. Hi, Councilwoman. We are fine with the process. We like the master RFP that's come out. We like the opportunity to create innovation in our program delivery. And so we're really excited to see what the outcome yields.
Any others?
Good afternoon, LaTanya Marie, Frontline Service. Good to see you.
Good to see you.
So this is the opportunity to apply for different things in different ways, to be creative. Our organization has been very excited about it. So we do like the idea of the Office of Homeless Services in the county thinking about service delivery in a different manner. And then just even allowing us to put forward our ideas, our wish list, our thoughts about how we can improve our service delivery, and just to see if they will be considered and provide us with our ability to discuss and present that. So we do think it's a good process and are glad that there was that extension period because it was a lot for a short period of time.
Councilwoman Conwell, if I just might add from our office's standpoint in regards to the ARPA release, we're extremely excited to have the opportunity for these one chance dollars, right? And really allow the continuum to have the opportunity to be creative, to be innovative, and making sure that the words we do have align then further with the priorities that we have within the continuum of care. So really, I feel like we've been working closely in making sure the continuum knows what those priorities are. So I would suspect we're going to have some very great and in-depth proposals to review that will have larger impact on our community as a whole.
Okay, so to be clear, for me to be clear, you mentioned the ARPA dollars in this master contract. Are they similar? I know the ARPA are one-time dollars.
The RFP that was just released is for ARPA funding, which is separate from the SG RFP that also included levy dollars for the two vendors that are before you today.
Any other questions? Councilman Sweeney, then Miller.
Thank you. Just on that, nice seeing you again. It's always a pleasure. It's exciting times that the results that you're hopeful for. The question on the ARPA dollars, those are anticipated but not confirmed yet.
Sure. Thank you, Councilman Sweeney. Yes, our understanding is that those are anticipated, and that's part of why, in response to Councilwoman Conwell's question, I didn't want to disclose a specific dollar amount.
Yeah,
those
good.
have yet to be allocated, and I think based on our experience with a couple of the recent RFPs that we've done, the one for food insecurity, chief among those, I know that what we did was, kind of had a dollar amount in the back of our minds, if you will, looked at the proposals that came in, and my team worked on preparing some recommendations for, allocations that we think would make sense to support award recommendations. But, even though that RFP is already done and reviewed and we've come up with our recommendations, those dollars have yet to be allocated. So my anticipation is that would occur closer to the contracts being reviewed, and probably, that would be an initial discussion. Here are the proposals we've gotten in. Here's what we're looking at recommending. Would council support X dollar amount to fund these proposals? So then the dollars would be allocated and we would come back with the awards after that.
Thank you. And I just, a follow-up, and then I have another one. Just how many under your purview, how many of the requests are ARPA that will be coming to council to be approved?
I don't know.
No dollar amounts, we got one here, per point, one there.
Yes, I don't know that we have a final figure on how many will come through HHS. I know the two biggest ones are this and the food insecurity, but I don't think that's meant to be, kind of a final list, if you will. I think I might need to defer to.
Oh, no, we're good. This is all
Italy
ballpark,
for me.
because it's live right now.
Sure.
The ARPA funding, and I want to make sure I have a full understanding of what's being requested.
Correct.
And I had that today by the presentations, and then as the process goes with the ARPA funds, I'll be in position to talk intelligently.
Absolutely, thank you.
Or to the best of my ability to look intelligent. Madam Chair, may I talk to the YMCA folks, if someone wants to come up?
Yes. Teresa Sanders.
Hello, Madam Executive Director. I'm Marty Sweeney. I don't know, we probably met. Just with the YMCA, as we did yesterday with archives, they came up and they started talking about what they actually do, how it's going, and try to be as open and free as you can to enlighten me on how the women's shelter or the YWCA is working.
Absolutely.
Is that okay? You just tell me what's on your mind.
I
If you don't
can.
mind,
So we are the operators of Norma Her Women's Center, and in the midst of the COVID pandemic, we have operated in 2 locations, at the Payne Avenue site as well as West 25th. In the year 2021, we served 871 unduplicated women in shelter services. The largest amount of those women fall between the ages of 25 and 34. We have seen in the last year a 5% increase in individuals seeking shelter services over 2020. We have really been supported incredibly by the Office of Homeless Services in our efforts to operate in 2 different locations. There was rapid response, a team of providers along with OHS who identified the best way to support deconcentration of the shelter. So we've been able to provide on-site COVID testing, vaccines, as well as incentive to help people exit shelter sooner. So, the biggest challenge for us really has been the impact of COVID on our staff. In December, we had a significant amount of employees that were either out ill with COVID or quarantining, but we're bouncing back from that. And when you have a lower level of staff, there's all kinds of other operational risks that you have to assess. We're hoping to also begin to look at the rate of pay that we're paying line workers. We are in a market in which McDonald's is now a competitor for us in terms of hiring employees. We want to ensure that the individuals that are working for us are not themselves at risk of homelessness. So we really are paying attention to the wage gap and what our bottom line minimum wage is as an organization. So it's been an incredible year, but we have an incredible team, and they've done great things in terms of supporting women to exit shelter and move into housing. We saw a decrease in the number of women who exited to permanent housing, and there are a lot of variables that drive that. But we continue to work both with other providers and landlords to assist women in exiting shelter.
very thorough, and thank you for doing that. And the one thing that, through the chair, you just said, our employees aren't getting paid that much. We want to stop them from becoming homeless and residents here is incredibly sobering or humbling. I'm like, we don't want to go that path. Facility-wise, the Payne Avenue site is a solid 1 to 10.
It actually is. Eden is actually the owner of the property, and they've been a great partner in terms of managing the facility. They manage the maintenance components, and they are in the process of assessing long-term options as it relates to the Payne Avenue site.
Okay, and the last one, within starting my second year now, I like going places to go visit. Could I schedule something just to come by and?
Absolutely.
Without any disrespect to the women that are there, I just won't mind getting a feel for it, see if I can help.
Absolutely. We would love to give you a tour.
I'll work through you.
Yes.
Thank you very much. Thank you, Madam Chairwoman.
Councilman Miller?
Madam Chair, Ms. Sanders, I would just like to follow up on the excellent line of questioning that my colleague started, and just to ask you, what are the specific operational challenges that you're dealing with right now that you think haven't been resolved yet and still have a ways to go? Is it unruly behavior? Is it drugs and alcohol? Is it getting residents to permanent shelter? Is it anything in the way of facilities or resources that you need and don't have? What kind of things are getting your most attention right now?
Right now, I would say it's our ability to engage in crisis de-escalation with guests in the shelter. So we have moved away from security, which might sound alarming, but I just want to give you some information about that. What we found in terms of security officers is that their lack of understanding and training around trauma-informed de-escalation impacts our environment. So we have in turn built our own, and we call it the Crisis Intervention Team. It allows us to work with guests around de-escalation with regards to mental health symptoms, also allows us to have less involvement of emergency services. So, we have a team of 4. It would be great if we could enlarge that team. It is a 24-hour operation, but that would be the primary focus in terms of operations and management of activities in the shelter, is to increase our ability to have trained individuals participate in crisis de-escalation.
Thank you.
If I could just say, I spoke with
Councilwoman Turner?
Deborah Matisse last week. I don't know, but I would like to join Councilman Sweeting.
Absolutely.
Thank you.
We'll reach out and schedule that. Thank you.
Okay, thank you. Is there anything other for the good of the order? Second reading suspension, Paul?
Thank you, Councilwoman Conwell. If we could, yes, because this does go back to a January 1 start date, that would be great.
All right.
I will move approval with recommendation for second reading suspension.
Second on Stevens. All in favor, please say aye.
Aye.
Thank you.
Thank you.
Any miscellaneous business from the committee? All right, hearing